Everybody. Hope you all got a chance to have some downtime and over the holidays, and just looking forward to 2021. A few things. Really, since the start of the COVID-19 pandemic, we've been partnered with the health district, and we've had three main goals: it's saving lives, protecting our healthcare system, and supporting our local economy. And one of the big reasons we've been able to sustain the intensity of our response was because of the resources we received from the federal government through the CARES Act. And I really want to thank our delegation, Senator Murray, Senator Cantwell, Congressman Larson, Congressman Del Bene. Really, their efforts have saved lives and just made it possible for us to do the efforts that we've been doing here locally. So thank you. 2 weeks ago, the Snohomish County Council approved my proposal to spend the last of our federal CARES Act, the money that was appropriated last year. This money that we still have remaining will let us keep our activities going through March of this year before they're exhausted. So thanks to the partnership with the County Council, former Chair Daring last year, and this year Chair Wright and Chair Dunn. Really looking forward to working with you this year. So on December 23rd, the council approved my proposal to spend the $13.2 million that we have remaining for the county's COVID response. And so I'll just go through a little bit of a breakout on how we're going to spend that $13.2 million. About $5 million will go to the Department of Emergency Management. So it's been activated since March 1st, 2020, and the Emergency Coordination Center in Everett has focused on meeting the benchmarks that were really established by Governor Inslee's Safe Start plan, and that those goals were really reducing the secondary impacts of COVID-19 on Snohomish County residents in two areas. One is really supporting our communities, but also getting ready for implementation of vaccination and recovery. So we also provided personal protective equipment in keeping our isolation and quarantine facility open. Two big efforts that we will continue under the Safe Start plan. We made really significant investments in PPE and believe that continuing to operate our PPE warehouse will be needed in 2021. We've been supporting our established food network in ensuring the availability of childcare for essential workers to reduce the secondary impacts of COVID-19 on our residents. Our food security work includes food distribution to our most at-risk residents via the Nourishing Neighborhoods program. It also includes support to school district lunch programs and our food banks. And we also continue to partner with the Boys and Girls Club and the YMCA Snohomish County to provide childcare for essential workers. Both of these efforts are necessary for the foreseeable future. So funding will also continue work being done in the ECC and Joint Information Center to ensure a well-coordinated response and communication to the public. The importance of these efforts is only heightened as we move into the vaccination phase of the outbreak. It is critical we work closely with our partners to make the vaccine available as widely as possible to our 840,000 residents in Snohomish County, including our historically marginalized communities. We're putting a special emphasis to make sure we reach everybody in our county. Human Services Department will receive $4 million. With that funding, we'll continue all areas of work that we've been conducting in 2020, includes continuation of eviction prevention, rental assistance, continuation of Northwest Washington's 211 expanded information and referral services. We will continue the community COVID outreach program, which really provides behavioral health services throughout the county. Continuation of the seasonal day and night shelter at the United Church of Christ in Everett. We will continue day sheltering operations at the Carnegie Library in Everett. Continuation of cold weather sheltering support, emergency services vouchers through the Family Support Center network, continuation of behavioral health, supports for families participating in child care early learning programs, and continuation telephone reassurance for individuals experiencing anxiety and other challenges. And finally, continuation of street outreach in connection to motel rooms, housing, and services. So a lot of amazing work to support our community has been going on. And thank again to the CARES Act dollars. The Snohomish Health District will receive $3 million. The Health District, as you know, has been providing critical services either independently or in collaboration with the county. These same efforts are expected to be maintained with these funds, the $3 million. The activities include community-based testing, case investigation and contact tracing, outreach investigations and control teams, vaccination implementation planning, and communications. Overall, the anticipated burn rate is approximately $1 million per month. So we can expect that the $3 million will fund activities at current resource levels through February and potentially all of March. Additionally, $1 million is going to be provided to economic development activities and those supports for our businesses through our R3 program. And finally, $200,000 will be provided for public safety purposes. Last year, we had a request from the Snohomish County Sheriff's Office for a complete body scanner for corrections use in the Snohomish County Jail. This body scanner will reduce the potential risk of exposure to COVID-19 by corrections staff and allows the staff to examine everybody being booked into the facility for any contraband without the need for staff to touch anybody. So that body scanner will be a valuable piece of equipment there. So we'll continue to work in 2021 with our partners, and I think we're all looking forward to a brighter year, and Happy New Year. With that, I'll turn it over to Dr. Spitters from the Snohomish Health District.
Thank you, Executive Summers, and a double thanks for the continued support of the CARES Act funding to continue our lane of activities in the pandemic. And just listening to you list the other activities that are being funded is a reminder of the tremendous partnerships we've had, both in directly working with one another, as well as seeing those county departments that address the branching impacts of the pandemic. So it's really been a much appreciated partnership and leadership by the county. Happy New Year, everyone. Here's to 2021 being a COVID overcoming year for all of us. It's been a couple of weeks since we last talked, so I want to give you a quick update on some of the key numbers. The case rate took a much desired drop for a couple of weeks after peaking in mid-December at about 440 cases per 100,000 per 2-week period. It came down to 350 per 100,000 during the 2-week period ending December 16 through January 2nd. It took a slight jump up, and so we just have to see where that goes. That may be a result of the holidays. It may be a result of factors other than disease transmission. There's a lot going on with the holidays affecting people's activities for exposure, as well as their healthcare seeking behavior, access to testing, as well as the flow of test results and reporting coming to us. So let's see where things go in the next couple weeks, but I hope we're able to resume the decline that we saw begin in the latter part of December. Long-term care facilities, they're still in a dire situation. We have 62 outbreaks. That's 62 settings with one or more cases in staff or residents, involving 14 of 17 nursing facilities, 19 assisted living, and 28 adult family homes. This level of disease activity in long-term care, particularly in the skilled nursing facilities, also causes a strain on our hospital system, both in terms of generating new hospitalizations among those who become severely ill, as well as impacting long-term care facilities' ability to accept discharges from the hospital, consequently further ballooning the hospital census that's putting the acute care system under strain. Still functioning, but definitely under strain. The COVID hospital census right now is 112 confirmed cases, 34 suspected cases have test results pending, and there are 11 patients with respiratory failure who are on mechanical ventilation. We also exceeded 400 deaths due to COVID this past week, currently at 403 lives lost in the last 11 months among the 24,000 total cases reported to date. On the positive end of things, the vaccine front, approximately 11,000 vaccine doses have been administered in Snohomish County. That's of approximately 40,000 vaccine doses distributed, and we anticipate getting in another 8,000 doses this week. The first group in Snohomish County eligible for the vaccine, known as Phase 1A, includes 15 to 16,000 healthcare workers in high-risk settings, COVID-facing settings like hospitals, emergency departments, primary care, et cetera, as well as patient-facing emergency medical service, emergency medical technicians, and employees at long-term care and similar adult care settings, as well as the residents or clients of those long-term care settings, number 12,000. So the Department of Health week before last also announced an expansion of Phase 1A to include all other employees in healthcare settings once the high-risk healthcare providers are vaccinated. So that includes, janitors, people, clerks, everyone in the buildings. And altogether, Phase 1A represents more than 40,000 people in Snohomish County who are eligible for vaccination at this time. And roughly, as I said, 1/4 of them have received their first dose. Like any new process, it takes time to achieve a velocity of vaccine administration that will permit vaccination to be completed in a reasonable amount of time. Federal partnerships were established with Walgreens and CVS to exclusively serve employees and residents at long-term care and similar adult settings, with an emphasis on skilled nursing facilities and assisted living facilities. The Health District and the Department of Emergency Management, along with other partners in the community, are also working to help augment the process for other adult care settings, including adult family homes. Stay tuned for more information on that and other development of other high throughput vaccination sites in the county as we progress forward. While most people currently eligible will receive their vaccines through their employer or through their healthcare system where they usually get care, the Health District has created a voucher program for 1A eligible employees of smaller agencies to be vaccinated by a participating partner. That's to address the many healthcare workers who don't work for an employer that is a vaccine provider. Instructions have been sent to eligible employers, but if they have not received that voucher or instructions on how to proceed, the employer can email COVID vaccine, all one word, COVIDVACCINE at snohd.org for assistance with that. We know there are a lot of people anxiously waiting for their turn to get the vaccine. While there are COVID-19 vaccines arriving, we do not have enough to offer it to everyone yet, and we're still building up the capacity, as I mentioned earlier, to get all those doses administered. All of that will pick up both the amount of vaccine that's distributed to Snohomish County as well as our capacity to put it into people's arms will continue to increase in the coming weeks and months. We will continue to follow state and federal guidance to make best use of the vaccine supply and our collective capacity to administer it. We urge your patience and cooperation with this gradual phased process that we aim to complete in approximately 6 months. More information about the next phases will be released soon. We encourage people to visit www.snohd.org/COVID vaccine for updates, as well as connecting with their healthcare provider to find out if they plan to offer the vaccine when that time comes. So now I'll turn it back over to Executive Summers.
Great. Thank you, Doctor. Um, let's see. First question we have is, is there any fear that doses could go unused here in the county?
Well, not really a fear, but certainly avoiding vaccine wastage is a key part of any vaccine program, whether it's COVID or whooping cough, flu, you name it. So that's why vaccine providers have to be, they have to apply to be a vaccine provider, get approved by the state, have the proper storage and other procedures to ensure the safety of the vaccine supply. As long as it's stored adequately, we have plenty of time. Having said that, some people look and say, well, you've got 40,000 doses, but only 11,000 in arms so far. But that just speaks to the difficulty of getting the capacity to administer up. We're on our way, we're making progress, but like any process, it takes a while to reach full speed.
So kind of a related question. Have we had any suggestions from the state what vaccine group 1B might look like? And since we know it's going to be a larger group, are we prepared to expand the staffing needed to meet that demand?
Yeah. Well, I can't anticipate. I'm not part of the discussions of what how the state is going to interpret or adopt the federal guidance. I'll just share with you what the federal guidance is for 1B, and that's on the medical risk side, aiming to reduce suffering, hospitalization, and death, is to aim for older adults 75 years and up, who account for 20% of hospitalizations and 50% of deaths. On the critical infrastructure or essential worker side of the equation, the federal guidance for 1B are public-facing essential workers including but not limited to law enforcement, firefighters who were not previously vaccinated as EMTs in phase 1, manufacturing, food production, food distribution, grocery workers, and school staff and teachers. There are some other groups in there, but those are the key ones. How that's going to be, the State Department of Health and the governor will translate that into guidance for us. We'll then take that and implement that. And yes, it's going to be a lot more people. And I think the key things that we need, as I've been saying a few times, are the capacity, not only the vaccine, but the capacity to administer that. We have about 40 various providers who have been approved to provide vaccine. There are another 50 whose applications are pending. We're trying to help get those pushed through. That will increase capacity in the traditional existing healthcare system, but it's just a fact that we're also going to have to complement that with high throughput, dedicated vaccination services that are maybe coordinated with the healthcare system, but standalone processes to get this done in a reasonable amount of time. We're going to need both kinds of activity going on.
And Doctor, this isn't in the chat, but want to speak a little bit about some of the challenges. I know we've been discussing this, that there will be private providers. Obviously, people that have healthcare will have to contact those providers, but we're also planning some public opportunities that will probably be on an appointment basis. And one of the complications is people have to remain on site or can't drive, particularly with the drive-through facility, have to remain at least 15 minutes. So it's not going to be a quick in and out type of process.
That's right. Absolutely. Executive Summers.
Related question, how will people be notified when it's their turn and where they will be getting vaccinated, particularly for the general public?
Right. Well, like most information, it will flow out in several manners. One, we'll obviously address it during these press briefings. We'll, in our other work with the media, we'll highlight the moments when particular groups of people become eligible. And then we'll need your help to get that word out. Our websites will also cover that. And then also the state is developing a web portal where individuals will be able to go in and enter their age, occupation, risk factors, and be assigned to a phase of the vaccine sequence and can sign up with an email or a cell phone number to get a reminder when their opportunity comes. And then the second half of that is finding a place to get vaccinated. The state's also working on a tool that they would connect to that platform to do that, and then we go from there. But as Executive Summers mentioned, a key thing also is to just touch base with your personal healthcare provider, your medical home, to find out if they're going to be offering vaccine in the future phases.
Since we don't know the impact of Christmas and New Year's, would you recommend the governor extend restrictions beyond next Monday?
Well, that's, we're still at a very high level of transmission, and the trajectory is provisionally going in the right direction, but we're certainly not out of the woods. So the exact constellation of restrictions that's the right recipe to maintain a safer environment and reduce transmission, I defer to the state and the governor on that, but I imagine there will be updates coming as that date approaches.
The information we have from the governor's office is that there will be a system in place, continue to be a system in place of restrictions, depending on the situation in the county or in the region. And so it seems clear to me that at least in the central Puget Sound area, we're nowhere close to really easing up on restrictions yet. We're just not headed in the right direction fast enough. So quite positive in our area, those restrictions will remain in place. Let's see. Question, how many vaccine clinics are set up in Snohomish County, and what methods is the county considering to expand clinics and access?
Well, as I said, there are approximately 36 entities in the healthcare system of varying sizes. All the large hospitals, the large clinic systems, they're all signed up, and receiving distributions variably, but overall, when I say variably, 1 week they get some, maybe not the next week. They're trying to spread it across the state and across the county to kind of balance needs. So we've got 36 signed up, 4 more dozen waiting for approval. So in the healthcare system, that will create 75 or more venues for folks to go. And then several, again, at this point, it's just vaccination of employees. So the large healthcare systems have set up, mass vaccination clinics for their staff, and are approaching completing that, or have completed that for their highest risk staff. And so now the next challenge for completion of 1A is to get those employees who are not employed by those healthcare systems, but they're other smaller systems, get them, going in to get vaccinated through those sites, as well as getting the pharmacy long-term care connection. It's up and running, but they just got their toes wet at the end of the year, and now they're really going to pick up in earnest in January. And that's all going to take another month or two, and it's on its way. And then to complement that, probably more geared toward when we transition to 1B, would be high throughput sites, either in partnership with with healthcare systems or large employers, that kind of thing, to try to set those up. But those are all in the developing the concept and planning, and I have no more detail to share with you on that.
So Dr. Fus, what is the difficulty in capacity in administering the vaccine? Is it staffing, scheduling, something else?
Well, I think, it's just like any new system. We're getting it started up, and the number of, lanes, if you think of it, for people to go through to get vaccinated, just, we're not at maximum speed yet. And, it'll take several weeks to a month to as we wrap up the our end, the non-long-term care end of healthcare workers, 1A, transition into 1B, then the demand for those high throughput settings will really be there for us to make progress.
Doctor, can you talk about the recent deaths from COVID? Is there an age breakdown? And have we seen the numbers start to slow?
In executive summaries, you said deaths, recent deaths. Yeah. Well, they're mostly older adults, largely. There's been a couple of younger adults, but, mostly the deaths occur in people 70, 75 on up. About half of those come from long-term care facilities. Others are people who reside in the community. And that's going to continue until we, get this curve to go down further and get the transmission under control and long-term care as well. So it's a combination of our own, human behavior, as well as, getting vaccine rolled out. That will help. But the help from vaccine, as you can see by my comments, that's more in the distant future, probably a few months till we start to see benefits of vaccine on a population level. Right now, we're really relying on everybody to continue to do all those things we've been asking since the start of the pandemic. So
do you have any goals for how many doses you would have liked to have administered by now, and how many we would like to going forward?
Well, I think, the eye is on the prize, which is getting everyone who wants to be vaccinated in Snohomish County vaccinated. And, there's 800, as you said, there's 840,000 of us. Ideally, we'd all have 2 doses in us within 6 to 9 months. Not everyone's going to want to do it. It's a voluntary thing. But we do, we estimates are that we need about 70, 80% coverage of the population to achieve enough barriers to transmission. That's the herd immunity threshold, roughly. There's a variety of estimates of what that percentage is. But the bottom line is we want to get as many people vaccinated in the next 6 to 9 months as we can. And, the sooner the better. But it takes a while to get the machine up and running. This kind of thing in a non-emergency setting would be a year of planning. And so we're doing the best we can on short time.
Dr. Spitters, is maintaining an order or priority at all slowing down the administration of vaccines? So, for example, if we were opened up to all people ages 65 over, and the vaccine was given to pharmacy, would that speed up the process? And I think that's getting at the supply demand or supply ability to administer question.
Exactly. Yes. And, there's kind of 3 factors at play. One is the supply of the vaccine. The one is the number of people eligible at a particular moment, the demand, and then there's the capacity for throughput. Right now, the limiting factors are the supply. We don't have enough vaccine to open up to a huge population. We also don't have enough throughput, so that if you did do that, even if you had the vaccine, we wouldn't have enough throughput to administer it, and you'd have, sort of choke points. You'd have people lining up in cars or on foot out the door, so to speak. And so we simultaneous with proceeding through the phases, we're trying to develop the capacity for that throughput that can match the supply as it comes, and then we'll designate the next group that's up to bat, so to speak.
So just to put a finer point on that, the amount of vaccine we're getting is still being metered through the federal government and allocated out centrally. So we're limited in what we can acquire. And I've heard you speak, Doctor, also that there's just a certain number of people, limited number of people can actually give vaccines. And that at some point is going to be a limiting factor, or could be.
Right. And getting all those, we're essentially trying to double or triple the number of approved vaccine providers. That will increase throughput, as well as I've said, standing up some high throughput kind of mass vaccination type settings. So we'll get there, but we're not there now.
Dr. Spitters, do you anticipate a rise in cases and hospitalizations because of the holidays?
Well, it's a possibility. That little inflection, that little bump up in the curve could be the shape of things to come in this next week, and we'd see more cases and more hospitalizations. But only time will tell. Certainly my hope is that that's not the case, but I imagine we all hope that.
Any updates on possible health district vaccination sites, similar to what the health district is doing with testing? And I'll just say there's several that are in the planning stages, and we do expect to have some up and operating. But again, we are in the planning phases. We were not given any additional dollars from the federal government to actually do these vaccination sites. We're trying to use our CARES Act dollars, and those were kind of on hold until the end of the year or so. But we are in the planning stage. And Doctor, do you want to give any more detail on that?
That's I really don't have much to add other than to you remind me that we were kind of stuck. We couldn't do too much planning back in November, December without the resources to implement that planning. And so here we are now, and we've had the funding extended, and we're trying to make the best use of it that we can as quickly as possible. More to come when relevant details are ready to share.
What about the idea of enlisting dentists to help with vaccine distribution?
Yes, I think the Dental Society reached out to us, and we're trying to connect them. Again, that'll help. That could help a bit, especially like if they're willing to vaccinate their own. They are 1A healthcare providers, but they have to get approved as vaccinators, and each specific location has to get approved to store vaccine and administer. So, we endorse any healthcare provider's effort, dentists, doctors, you name it, that who's licensed and allowed to give vaccine to do so. But small operations with low flow through them are not going to get us there. So the dentists can help, but like any routine healthcare service, primary care, et cetera, the throughput there will help, but it's not going to get us to the finish line in the time we need. So we're going to continue to also focus on large large throughput type venues.
Yeah, we are definitely working hand in glove with the health district to stand up some higher capacity, more public vaccination sites. So that is definitely in the works. But again, details will be provided as we get them. We don't want to give out any information. They're still actually in the formative stages. So, but in the coming days, we hope to have more information on those sites. Last question, can you speak to how valuable it will be to have long-term care facility residents and hospital staff vaccinated?
Well, I can only repeat my earlier, my conclusion is that it's exceedingly important. And the reason, again, is that 20% of the hospitalizations and 50% of the deaths are in long-term care, come from long-term care settings. The number of cases are roughly split equally between staff and residents. Most of the hospitalizations and deaths are in the residents, but by and large, the residents are catching it from staff. So we've got to get that all covered, and that will provide us quite a buffer. You know, it's not going to eliminate COVID as a public health problem, but it provides us quite a buffer in the healthcare impacts and a 50% reduction in deaths. So that would be welcome news as soon as we can get it done.
Great. I think that wraps us up. Thank you, everybody.
Thank you, everyone. We appreciate you joining us this morning. We will continue our Tuesday media availabilities, so please stay tuned for future advisories on those. Happy New Year.